Nearly all babies assigned male at birth, AMAB, have physiological phimosis. As newborns age, the foreskin changes gradually so it can pull back. Medical professionals estimate only about 1% of people still have physiologic phimosis when they're 16 or older. Less than 1% of children have pathologic phimosis. In this video, we will talk about this disease, phimosis, by answering these questions. What is phimosis? What are the types of phimosis? What causes phimosis? Symptoms of phimosis. How's it treated? What is phimosis? Phimosis describes a condition in which the foreskin is too tight to be pulled back over the head or glans of the penis. Most uncircumcised babies and toddlers will have phimosis, meaning the foreskin cannot be retracted. This is because the glans and the foreskin remain connected for the first few years of life. There are two types of phimosis. Physiological phimosis. Physiologic phimosis occurs more often in children. It usually resolves as they get older. Pathologic, congenital, phimosis. Infection, inflammation or scarring cause pathologic phimosis. Lichen sclerosis is a common cause. What causes phimosis? If you or your child has pathologic phimosis, the most common causes are infection, including sexually transmitted infections, STIs, or scarring. If you have foreskin, it's important to thoroughly clean the glands with mild soap and warm water. Dry the area with a clean towel afterward. Other phimosis causes may include skin conditions, including eczema, psoriasis, lichen planus and lichen sclerosis, penile, prepucial, adhesions, or scar tissue that keep the foreskin attached to the tip of your penis. Injuries. Symptoms of phimosis. Phimosis does not always lead to symptoms. When it does, however, these may include redness, soreness, or swelling. If your foreskin feels tight and is difficult to retract, you may have phimosis. Other symptoms include ballooning of the foreskin during urination, pain when urinating or when you have an erection. How's it treated? Treatment options for phimosis depend on the symptoms that occur. The first treatment healthcare providers usually try for pathologic phimosis typically includes a topical corticosteroid cream or gel. You rub these medications directly onto your penis. Providers may also suggest that you start stretching the foreskin about 2 weeks after starting to use a corticosteroid cream. Pull the foreskin back gently, only as far as you can without it hurting. Keep applying the cream on the areas of your glands that you expose through these foreskin stretching exercises. They'll also prescribe antibiotics if you have an infection in your foreskin or glands. You may need phimosis surgery if a corticosteroid cream doesn't work. This typically involves a circumcision. During a circumcision, they remove the foreskin to completely expose the gland. Thank you for listening to all the information we want to introduce to you in this video. Do not forget to like, share and subscribe for the Info channel.